No providers, no access. No providers, no access. No providers, no access. No providers, no access. No providers.
We've got a mental health crisis in our country.
Yes,
no?
Sir.
Yes. There are too many people suffering with mental illness for which they cannot get care. Do you agree with me?
Yes.
Yes. Those people need the services they need and deserve. Are you with me?
Yes.
And they deserve to get the health care they already paid for. Are you with me?
Absolutely.
But now they're telling us that they can't get health care from the people who are out there able to deliver them health care. Why? Because they don't want to reimburse you for the health care you provide.
Yep.
It is about exerting control over the system so that they can make more money. But again, none of us pay our premiums every month so that they get to make money. We pay our premiums every month so that we can get health care. And these actions are about denying people health care so they can make money. And we stand up here today to call bullshit. Bullshit to tell people what kind of mental health care they can get. It is bullshit to put your profits over people's health care. It is bullshit to say that for folks, especially in rural communities, who cannot get mental health care except for through the health care that social workers and therapists provide, that they no longer can get their health care because they're stuck under the health care auspices of one corporation that dominates 70% of the health insurance market in this state.
Yep. Well, that's right.
We've got
Quality care comes from quality providers, not from a facility or the contracts that they have people with.
This has never been just about billing. This is a workforce issue. This is an access to care issue. This is a continuity of care issue. And ultimately, it's about whether Michiganders can get behavioral health care when and where they need it. Every reimbursement policy is ultimately a patient and client access policy, point blank period.
It's a corporation that makes its money by saying no, that makes its money by saying you can't have the health care that you need. And we know that the first people they try to devalue are always going to be women and queer people and people of color. And we know that's why they're coming after groups like limited license providers, like people that are doing vital healthcare work everywhere in our state, everywhere in our society. It's up to us to stand up for those folks, to stand up for everyone, and to make sure that these institutions that have power in our society don't get to tell people that their work doesn't matter.
I'm here for you guys to help you fight for this opportunity, for them to listen to what you guys have to say, because we are constantly being shut out because we're only limited license, right? But it doesn't just start here. It continues on to other avenues and other individuals who are being closed out, not just from Blue Cross Blue Shield, but from other places as well. So I appreciate you guys for standing up to the big corporation and doing what's necessary so that you guys can be heard.
We can't do what we're doing now without you. We already know Michigan is short, right? We are short-handed in every part of the state. 60% of the people in the state do not have access to mental health care. You know this.
Yes.
We need more of you, not less. The worst thing that can happen is when social workers get chased out of our state because they're not going to get paid. That's outrageous. We should be paying you more than you've ever gotten before. Every day you work, you become more important to the people of our state.
How many communities are going to go underserved because of this change? This policy change will cost lives. And that is why we are all here today. Because each and every one of you are here standing for your communities, for your profession, for the state of Michigan.
And this is what makes a coalition powerful. No single organization owns this movement. No single profession is affected by this policy, and no single group is going to solve it alone. Social workers, counselors, psychologists, marriage and family therapists, private practice owners, educators, students, clients, community organizers, advocates, and lawmakers have all brought something different to this fight. And together, what have we done? We've written letters, we've collected data, we've made calls, we've met with policymakers, we've organized, and we've protested. And today, all of those different voices have come together here at the Blue Cross headquarters to let them hear you!
is no rhyme or reason that they can provide for the changes that they are making. Now, Blue Cross Blue Shield has told us this is about making sure that all of their consumers have access to higher quality care. We know that's not true. They have said that this policy is about preventing fraud. We know that's not true because they can't even give us any data about this fraud. And they tell us that this is about ensuring excellent supervision for limited licensed practitioners. And y'all know that that definitely ain't true.
I've asked them, I've had meetings with them, I have asked them countless times to show me where the quality of care from private practice is less than anywhere else. They keep telling me that they're researching the data, they don't know if they can get it to me or not, and they're just dragging their feet because they know that this was a financial decision.
First, I want to say something to Blue Cross Blue Shield. How many people in Michigan will lose their current therapist, have to tell someone else their entire life story from the beginning? You don't know. You say that you want to protect against fraud in private practice, but also can't give any of that data. Does that mean that you're witnessing fraud and not reporting it?
Blue Cross, change your side.
And now, Blue Cross has pointed to outpatient psychiatric care facilities, or OPCs, as a potential alternative.
Boo!
And that idea that we need psychiatrists to be part of these OPCs, the first thing that I go is, how many of you do you know that have psychiatrists who have space on their workloads? How many? When can you find somebody to refer to? Never. And so they expect us to have every office have a psychiatrist in a supervisory capacity to offer care. Do you know how many licensed psychiatrists there are in the state of Michigan?
How many?
Under 1,800. And that includes the people that are out of state who are just licensed here. All of those people have caseloads. They already have jobs. They're not waiting to come and help us see our communities. And so when they say, oh, just become an outpatient psychiatric center, they know this. They know that we don't have the time and resources to get an accreditation that takes months and months of preparation. Yeah. And so they say, well, we left you a route, but that route is impossible. I have worked in private practice for the past 10 years, and I have not known one single practice who could meet this.
BCBS says it's too large to afford oversight for the care. We can't put that burden on a Michigan psychiatrist. There simply are not enough psychiatrists, and how could they then oversee thousands of additional clinicians? Does that sound like quality oversight? No! That's a setup not just for the people that they serve, but for these psychiatrists, for these healers. Let me tell you something, Abdul, and every other legislator and the people of Michigan. Mental health providers are actually not superheroes. Newsflash, they're human beings. Hear our call. Access to care for one and all. Blue Cross has a monopoly-like hold on our healthcare system. One company has so much power, like Noel was saying. One policy can change the entire game. It will shift the landscape of access to mental health care in our state. Let us not forget that mental health care is life-saving care. It is suicide prevention. It is substance use and addiction prevention. It's domestic violence and sexual assault prevention. It's crime and hate crime prevention.
And nowhere is that more concerning than in rural Michigan. One of my greatest concerns from the beginning has been what this policy could mean for northern Michigan and the Upper Peninsula. Because we are not starting from a place of equal access. I'm going to share some glaring statistics from a Mahaka policy brief, and I'd like you all to boo after each one. Can we do that? 25 Michigan counties have no psychiatrist. 10 counties have neither a psychiatrist or a psychologist. 70% of the Upper Peninsula primary care physicians report having no psychiatrist available for referral. Think about that in the context of what we're discussing today. Blue Cross is pointing to OPCs as a potential pathway for continuing supervised care. But Blue Cross's own requirements for an OPC include having a psychiatrist as a part of the care team. How does a small practice in northern Michigan simply become an OPC when the workforce needed to satisfy those requirements isn't there? In many rural communities, private practices aren't just another option for behavioral health care. They're part of the infrastructure keeping behavioral health care available at all. A standard that cannot be met is not quality assurance, it is denial of access by another name.
Rural healthcare matters! Rural healthcare matters! Rural healthcare matters!
Honestly, I'm calling on you, Mike, and every other rep that I met here today. I'm calling on all of you to reinstate the mental health legislative task force that Isaac Robinson started in 2020 before he passed.
Because the next step, if they will not pause, if they will not rescind, is legislation. Legislation that the states of Illinois and Colorado have already passed. We can pass that same legislation here in Michigan. And let me tell y'all, we have multiple legislators here today who support us. We have multiple legislators here today who are willing to fight for us and who are willing to close their hands when Blue Cross Blue Shield offers them money to do their bidding.
And we will do whatever it takes to get this fixed. We will build that legislation and we will drum on people until it gets passed. We will do everything we can for you.
I'm looking forward to picking up the mantle from Illinois and Colorado, working with Mike and Kimberly and Rosemary and everyone else in the legislature to make sure we do the right thing. And I need you to hold us accountable, make that happen, because we cannot settle for any less.
What do we do?
Stand up, fight